Most people think blood pressure is something that rises during the day and then quietly settles down once they go to sleep. In a healthy body, that is exactly what should happen. During sleep, the heart slows down, the nervous system shifts into a calmer state, and the blood vessels relax. Because of this, blood pressure normally drops by about 10 to 20% compared with daytime levels. Doctors call this the nocturnal dip, which simply means the normal nighttime fall in blood pressure. When that dip does not happen, something important in the body's regulation system is not working the way it should. My name is Dr. Warren Hung, and on this channel we explain how the body actually works so people can protect their long-term health. If you care about understanding the science behind everyday health decisions and how the body regulates itself over time, consider subscribing. The goal here is simple: clear explanations that help you make better decisions for your future health. Now let's look closely at what normally happens to blood pressure once the body moves into sleep. Throughout the day, your body is constantly adjusting blood pressure to meet different demands. When you stand up, pressure rises slightly to keep blood reaching the brain. When you exercise, the heart pumps faster to deliver oxygen to the muscles. When you are stressed, hormones tighten the blood vessels and raise pressure temporarily. All of these changes are controlled by several systems working together. One of the most important is the autonomic nervous system. This is the automatic control system of the body, the part that regulates heart rate, breathing, and blood vessel tension without you needing to think about it. The autonomic nervous system has two major branches. One branch is the sympathetic system, which prepares the body for activity. It raises heart rate, tightens blood vessels, and increases blood pressure when the body needs energy. The other branch is the parasympathetic system, which does the opposite. It slows the heart, relaxes blood vessels, and helps the body recover and restore itself. During the day, both systems take turns adjusting your blood pressure depending on what you are doing. At night, the balance shifts strongly toward the calming side. Heart rate slows, blood vessels widen, stress hormone levels fall. Because of these changes, blood pressure normally declines once sleep begins. Researchers have observed this nighttime drop for decades. One of the longest-running cardiovascular studies in the world, the Framingham Heart Study, helped document how blood pressure patterns change across the day and night, and how these patterns relate to heart disease risk. The pattern is very consistent in healthy adults. When sleep begins, blood pressure gradually falls. During the deepest stages of sleep, it stays lower than daytime levels. Then, in the early morning hours, the body begins preparing to wake up. Hormones such as cortisol and adrenaline start to rise again, heart rate increases slightly, and blood pressure begins climbing before you even open your eyes. This is why heart attacks and strokes often occur in the early morning hours. Large population studies, including research from the American Heart Association and European Society of Cardiology, have shown that this morning rise in pressure can stress the cardiovascular system, especially in people who already have hypertension. But another pattern can be even more concerning. Some people never experience the normal nighttime drop at all. Their blood pressure stays elevated throughout the night. Doctors sometimes call this non-dipping hypertension. Instead of falling by 10–20%, blood pressure may drop only slightly or sometimes not at all. In certain cases, it may even rise during sleep. Studies using 2 4-hour ambulatory blood pressure monitoring, which tracks pressure continuously through the day and night, have shown that people with non-dipping patterns often face higher risks of heart disease, stroke, and kidney damage. Research published in the Journal of the American College of Cardiology has shown that nighttime blood pressure can actually predict cardiovascular risk more strongly than daytime readings. That may sound surprising. After all, most people only measure blood pressure during the day, usually sitting in a clinic, pharmacy, or at home in the morning. But the body does not stop regulating blood pressure once the lights go out. In fact, the overnight hours are when many important repair processes occur. The heart rests. Blood vessels recover from daytime stress. The kidneys regulate fluid and salt balance. The brain clears metabolic waste through a circulation system that becomes more active during deep sleep. If blood pressure stays elevated during these hours, those repair systems may not function as efficiently. Over time, that continuous pressure can place strain on delicate tissues, particularly the small blood vessels in the brain, kidneys, and eyes. This is one reason doctors have become increasingly interested in nighttime blood pressure patterns. Technology has made this easier to study. A 2-4-hour ambulatory blood pressure monitor is a portable device worn on the arm for an entire day and night. It automatically inflates every 20 to 30 minutes during the day and every 30 to 60 minutes during sleep, recording how pressure changes across the full cycle. Studies using these monitors have shown that many people with normal daytime readings actually have elevated pressure during sleep. This condition is sometimes called masked hypertension because it remains hidden during routine office measurements. And this is where the question behind today's topic begins to matter. If blood pressure should normally fall at night, why does it sometimes stay high? Why do some people lose the natural nighttime dip that protects the heart and blood vessels? And if nighttime pressure remains elevated, are there small, practical things, including certain drinks before bed, that may support the body's natural relaxation systems? Those are the questions we are going to explore step by step. First, we need to understand what causes blood pressure to remain high during sleep in the first place. And once those mechanisms become clear, the role of certain bedtime drinks will make much more sense. When doctors look at nighttime blood pressure patterns, one thing becomes clear very quickly. The body does not lose its nighttime blood pressure drop for a single reason. Usually, several systems are involved at the same time. Blood vessels may have become less flexible. Stress hormones may remain elevated after dark. The kidneys may retain more sodium than they should. Or sleep itself may not be deep enough to allow the body to enter its normal recovery state. To understand why nighttime blood pressure stays high, it helps to examine the systems that normally lower it. The first is the autonomic nervous system, the automatic regulator of heart rate and blood vessel tension. Earlier we discussed the two branches of this system. The sympathetic system raises heart rate and tightens blood vessels when the body needs to be alert. The parasympathetic system slows the heart and relaxes the body when it is time to rest. During sleep, the calming parasympathetic system should dominate. Heart rate slows. Blood vessels widen slightly. Blood pressure falls. But in many people with hypertension, this nighttime shift does not occur properly. Research using nerve activity recordings has shown that people with high blood pressure often have persistent sympathetic nervous system activation even during sleep. In simple terms, the body remains in a mild, alert state. The heart keeps working harder than necessary, and blood vessels remain tighter than they should be. Studies published in Hypertension, the Journal of the American Heart Association, have documented this pattern in patients with resistant hypertension and metabolic disease. The second system involved is vascular flexibility. Healthy arteries behave like elastic tubes. When the heart pumps blood into them, they stretch slightly. This elasticity absorbs pressure and helps keep blood flowing smoothly. But arteries gradually become stiffer with age. This process is known as arterial stiffness, and it is influenced by factors such as long-term high blood pressure, inflammation, diabetes, and smoking. When arteries stiffen, they cannot expand as easily when blood is pumped into them. That causes pressure inside the vessel to rise. Research from the UK Biobank cardiovascular imaging studies has shown that arterial stiffness strongly predicts nighttime hypertension and loss of the normal nocturnal dip. The third system involves the kidneys and salt balance. The kidneys regulate how much sodium and water remain in the body. Sodium, which most people know as salt, affects blood pressure because it influences how much fluid stays in the bloodstream. If sodium levels remain high, the body retains more water. More fluid inside blood vessels means higher pressure against the vessel walls. During sleep, the kidneys normally adjust fluid balance as the body rests. But in people who consume large amounts of sodium or who have reduced kidney efficiency with age, fluid regulation can remain elevated overnight. Large population research, including data from the InterSalt study, has demonstrated a strong relationship between sodium intake and blood pressure patterns across many countries. Another factor is insulin resistance. Insulin is the hormone that allows cells to use glucose from the bloodstream for energy. When the body becomes resistant to insulin, a condition often associated with prediabetes or type 2 diabetes, several changes occur that can raise blood pressure. The kidneys may retain more sodium. Blood vessels may become less responsive to relaxation signals. and the sympathetic nervous system may become more active. The NHANES survey data in the United States has repeatedly shown that people with insulin resistance and metabolic syndrome have a higher rate of nighttime hypertension. Then there is the role of sleep quality itself. Sleep is not a uniform state. The body cycles through several stages during the night, including light sleep, deep sleep, and rapid eye movement sleep. The deepest stages of sleep are where the strongest blood pressure reductions occur. During deep sleep, heart rate slows significantly and blood vessels relax. But if sleep is fragmented, meaning a person wakes frequently or never reaches deeper sleep stages, the body may not experience the normal nighttime pressure reduction. One common cause of this is sleep apnea. Sleep apnea is a condition where breathing briefly stops during sleep due to airway obstruction. Each time breathing stops, oxygen levels drop slightly and the brain briefly wakes the body to restart breathing. This repeated cycle can happen dozens of times per hour. Every episode triggers a surge in sympathetic nervous system activity, which raises blood pressure. The Sleep Heart Health Study, one of the largest investigations of sleep apnea and cardiovascular disease, found that untreated sleep apnea significantly increases the likelihood of nighttime hypertension. Many people with sleep apnea do not realize they have it. They may simply notice fatigue during the day, morning headaches, or loud snoring reported by a partner. Now let me briefly share a moment from clinical practice that illustrates how quietly this pattern can develop. I once saw a patient in his early 70s who told me something interesting during a routine blood pressure visit. His readings during the day were only mildly elevated, but his home monitor showed much higher numbers when he checked late in the evening. He assumed the device must be faulty because he felt completely fine. When we later confirmed his overnight readings with a 2-4-hour monitor, his blood pressure stayed high throughout most of the night. And this illustrates something important about how the body works. High blood pressure rarely produces symptoms until damage has already developed. The blood vessels, heart, and kidneys can experience stress for years before a person notices anything unusual. That is why physicians sometimes call hypertension a silent condition. Research from the European Society of Cardiology blood pressure guidelines emphasizes that nighttime blood pressure is one of the strongest predictors of future cardiovascular events, including stroke. Another contributor that is often overlooked is late evening stress and stimulation. Exposure to bright light, intense mental activity, heavy meals, alcohol, and even late caffeine intake can interfere with the body's transition into its nighttime recovery state. Caffeine, for example, blocks adenosine receptors in the brain. Adenosine is a chemical signal that helps the brain recognize fatigue and transition towards sleep. By blocking that signal, caffeine can keep the nervous system in a more alert state for several hours. For some people, even afternoon caffeine consumption can influence nighttime blood pressure. Alcohol can have a similar effect. Although alcohol may initially make people feel relaxed or sleepy, it can disrupt deeper sleep cycles later in the night. Large observational studies, including data from the UK Biobank, have shown that regular alcohol consumption is associated with higher nighttime blood pressure readings. When several of these factors combine, vascular stiffness, sodium imbalance, metabolic changes, poor sleep, and persistent sympathetic activation, the normal nighttime drop in blood pressure may disappear. The body remains under higher pressure during the hours when it should be recovering. This brings us to the practical question that many patients ask. If certain systems influence nighttime blood pressure, such as blood vessel relaxation, mineral balance, and nervous system activity, are there simple things people can do in the evening that may help support the body's natural nighttime regulation? Some drinks contain compounds that may influence these systems in small but measurable ways. But to understand which drinks might help and why, we need to look closely at the physiology involved. And that is exactly where the 5 bedtime drinks come in. Once we understand why blood pressure sometimes remains elevated at night, the next question becomes practical. Are there simple things people can do before bed that support the body's natural nighttime regulation? Certain drinks contain compounds that influence blood vessels, mineral balance, and the nervous system. These effects are not cures for hypertension, and they cannot replace medical treatment when it is necessary. But in the right context, they may support the physiological systems that help blood pressure settle during sleep. The key is understanding what each drink does inside the body. Let's go through them one by one. 1. Tart cherry juice. Tart cherry juice has attracted attention in cardiovascular research because it contains high levels of polyphenols and anthocyanins. Anthocyanins are natural plant compounds that give cherries their deep red color. These compounds act as antioxidants and may help improve endothelial function. The endothelium is the thin inner lining of blood vessels. It plays a crucial role in regulating blood pressure because it produces a molecule called nitric oxide. Nitric oxide signals the surrounding muscles in blood vessel walls to relax. When vessels relax, their diameter widens slightly, and pressure inside them decreases. Studies have shown that people with hypertension often have reduced nitric oxide signaling, which contributes to tighter blood vessels. A randomized study published in the American Journal of Clinical Nutrition examined the effects of tart cherry concentrate in older adults. Researchers observed improvements in vascular function and modest reductions in systolic blood pressure after regular consumption. Another reason tart cherry juice may be relevant at night involves melatonin. Melatonin is the hormone that signals the body that it is time to sleep. Tart cherries naturally contain small amounts of melatonin, which may support the body's normal sleep rhythm. Better sleep quality can indirectly support nighttime blood pressure regulation because deeper sleep stages promote stronger parasympathetic activity. A small evening serving of tart cherry juice, typically diluted concentrate or unsweetened juice, is the form studied most often. The key point is not that cherry juice lowers blood pressure instantly, but that its compounds may support vascular relaxation and sleep regulation, two systems involved in nighttime blood pressure control. 2. Beetroot juice. Beetroot juice is one of the most widely studied foods in blood pressure research. The reason is its high concentration of dietary nitrates. Nitrates are compounds that the body can convert into nitric oxide, the same molecule that helps blood vessels relax. Here is how the process works. After nitrate is consumed, bacteria in the mouth convert it into nitrite. Once nitrite enters the bloodstream, it can be further converted into nitric oxide inside blood vessel walls. This pathway helps widen blood vessels and improve circulation. Several controlled trials have examined the effect of beetroot juice on blood pressure. A well-known study published in Hypertension, the Journal of the American Heart Association, found that a single serving of beetroot juice lowered systolic blood pressure by several millimeters of mercury within hours in adults with hypertension. Longer studies have also shown sustained reductions when nitrate-rich foods are consumed regularly. Another investigation from the University of London and Queen Mary University of London followed patients with hypertension who consumed nitrate-rich beetroot juice daily for several weeks. Researchers observed improvements in blood pressure and endothelial function. For bedtime use, the potential benefit relates to the nitric oxide pathway. When nitric oxide levels increase, blood vessels relax more easily. That relaxation can support the natural nighttime decline in pressure. One important note is that beetroot juice can temporarily cause urine or stool to appear reddish in color. This harmless effect is called beeturia and simply reflects the pigments in the vegetable. 3. Hibiscus tea. Hibiscus tea is made from the dried calyces of the Hibiscus subdurifa plant. The deep red color of the tea comes from the same class of plant compounds we discussed earlier, anthocyanins and polyphenols. These compounds appear to influence blood pressure through several mechanisms. First, they may help improve endothelial function, allowing blood vessels to relax more easily. Second, hibiscus compounds may act as mild ACE inhibitors. ACE stands for angiotensin-converting enzyme, an enzyme involved in the renin-angiotensin system, one of the body's major blood pressure control systems. When ACE activity is reduced, the body produces less angiotensin II, a hormone that tightens blood vessels and raises blood pressure. Several blood pressure medications work by blocking this exact pathway. Hibiscus tea is not a substitute for those medications, but laboratory studies suggest that some of its compounds interact with the same system at a much milder level. Clinical trials have examined its effects. A randomized trial published in the Journal of Nutrition studied adults with mild hypertension who drank hibiscus tea daily for 6 weeks. Participants experienced modest reductions in systolic blood pressure compared with a control group. Another meta-analysis published in Phytomedicine reviewed multiple clinical trials and found that hibiscus tea consumption was associated with measurable reductions in both systolic and diastolic blood pressure. Because hibiscus tea contains no caffeine, it is suitable for evening use. Drinking a warm beverage before bed may also promote relaxation and help transition the body towards sleep, supporting the parasympathetic system we discussed earlier. 4. Warm milk. Warm milk may sound simple compared with the other drinks, but it interacts with several physiological systems related to sleep and nervous system regulation. Milk contains the amino acid tryptophan. Tryptophan is a building block used by the body to produce serotonin, a neurotransmitter that influences mood and relaxation. Serotonin can then be converted into melatonin, the hormone that regulates the sleep-wake cycle. Although milk does not contain large amounts of tryptophan compared with some foods, consuming it before bed may contribute modestly to melatonin production in certain individuals. Milk also provides calcium. Calcium plays a role in muscle contraction and nerve signaling, including the contraction and relaxation of blood vessel walls. Population research, including data from the DASH dietary trials, dietary approaches to stop hypertension, has shown that diets rich in calcium, potassium, and magnesium are associated with lower blood pressure levels. In the DASH trials, participants following a diet rich in fruits, vegetables, and low-fat dairy products experienced significant reductions in blood pressure compared with those following a typical Western diet. A warm beverage itself may also promote relaxation. Warm liquids can stimulate parasympathetic activity and encourage the body to enter a calmer state before sleep. For people who tolerate dairy well, a small serving of warm milk in the evening may support both sleep quality and mineral intake, two factors related to nighttime blood pressure regulation. 5. Chamomile tea. Chamomile tea has been used for centuries as a calming herbal drink. Its primary active compounds include apigenin, a flavonoid that interacts with receptors in the brain associated with relaxation. Apigenin binds to GABA receptors, which are involved in calming nervous system activity. GABA stands for gamma-aminobutyric acid, a neurotransmitter that reduces nerve signaling and promotes relaxation. When GABA activity increases, heart rate slows slightly and the nervous system shifts toward the parasympathetic state associated with rest. Although chamomile is often discussed for sleep, its influence on the nervous system may also support nighttime blood pressure regulation by reducing sympathetic activation. Research published in the Journal of Advanced Nursing examined chamomile tea consumption in older adults and found improvements in sleep quality among participants who drank the tea regularly. Better sleep can indirectly support healthier nighttime blood pressure patterns. Chamomile tea also contains small amounts of antioxidants that may support vascular health over time, although this effect is modest compared with the compounds found in berries or vegetables. Because chamomile contains no caffeine, it can be consumed close to bedtime without stimulating the nervous system. These 5 drinks, tart cherry juice, beetroot juice, hibiscus tea, warm milk, and chamomile tea, each interact with one or more of the systems that influence nighttime blood pressure. Some support blood vessel relaxation through nitric oxide pathways. Some support mineral balance important for vascular function. Others support sleep and nervous system calming, which helps the body transition into its natural nighttime recovery mode. None of these drinks should be viewed as a replacement for medical treatment when hypertension requires medication. But they may support the biological systems that allow blood pressure to settle overnight. But to use them properly, it is important to understand when they may help, when they will not, and how they fit into the larger system that controls blood pressure during sleep. By now, you can see that these 5 drinks influence several biological systems. Some help blood vessels relax. Some support mineral balance inside the bloodstream. Others encourage the nervous system to shift into a calmer state before sleep. But an important medical point must be clear. These drinks can support the body's nighttime regulation. They do not control blood pressure by themselves. To understand why, we need to look at how blood pressure is actually regulated across the entire body. Blood pressure is not controlled by a single organ. It is the result of several systems working together every minute. The heart pumps blood forward. The arteries expand and contract to regulate pressure. The kidneys control fluid and sodium balance. The nervous system adjusts heart rate and vessel tension. Hormones from organs such as the adrenal glands and kidneys also influence pressure throughout the day. Doctors sometimes describe blood pressure as a system-level function, meaning that no single change can control it completely. This is why hypertension management usually involves several strategies working together. Let's start with the role of the kidneys, because they are central to nighttime blood pressure. The kidneys filter blood continuously, removing waste products and adjusting the balance of sodium and water in the body. When sodium intake is high, the kidneys retain more fluid to maintain proper chemical balance. More fluid inside the bloodstream increases pressure inside blood vessels. Over time, the kidneys attempt to compensate by excreting excess sodium, but this process can take many hours. This means that a high-sodium meal late in the evening may still influence blood pressure during sleep. Research from the InterSalt International Study, which examined sodium intake and blood pressure patterns in more than 10,000 participants across multiple countries, demonstrated a strong relationship between salt consumption and hypertension. Reducing sodium intake during the day often has a larger effect on blood pressure than any single nighttime intervention. The next system involves blood vessel flexibility. Healthy arteries contain elastic fibers that allow them to stretch slightly when blood is pumped from the heart. This elasticity helps absorb pressure and maintain smooth blood flow. With aging, these elastic fibers gradually become stiffer. Long-term high blood pressure, smoking, and diabetes can accelerate this process. When arteries stiffen, the heart must generate more pressure to push blood through them. Large cohort studies, including imaging research from the UK Biobank Cardiovascular Database, have shown that arterial stiffness strongly predicts both daytime and nighttime hypertension. Improving vascular health takes time. Regular physical activity, balanced nutrition, and proper treatment of hypertension all help protect blood vessel function. No drink consumed at bedtime can reverse vascular stiffness overnight. The third system that matters is sleep quality itself. Deep sleep plays a major role in lowering nighttime blood pressure. During deeper stages of sleep, sympathetic nervous activity falls and parasympathetic activity increases. Heart rate slows. Blood vessels relax. Blood pressure declines. But if sleep is disrupted, this restorative pattern may never fully develop. Conditions such as sleep apnea can prevent the body from entering deeper sleep stages. As discussed earlier, the Sleep Heart Health study demonstrated that untreated sleep apnea significantly increases nighttime blood pressure and cardiovascular risk. If someone regularly snores loudly, wakes frequently during the night, or feels extremely tired during the day, discussing sleep evaluation with a physician may be more important than focusing on bedtime drinks alone. Now let's talk about how these drinks fit into the bigger picture. The best way to think about them is as supportive signals to the body. A nitrate-rich drink like beetroot juice may support nitric oxide production, helping blood vessels relax. A calming herbal tea like chamomile may support the nervous system's transition toward rest. A drink containing minerals such as potassium or calcium may support vascular and nerve function. But the effect of these drinks depends heavily on context. If someone drinks a calming herbal tea but also consumes large amounts of sodium at dinner, the kidney-driven fluid balance may still keep pressure elevated overnight. If someone drinks tart cherry juice but sleeps only 4 hours because of stress or screen exposure, the nervous system may remain activated. That is why physicians usually look at patterns, not single actions. For people who want to use these drinks in a helpful way, several practical points matter. First, timing is important. Drinks intended to support relaxation or vascular function are usually best consumed 30 to 60 minutes before sleep. This allows the body time to begin processing the compounds before the deeper stages of sleep begin. Second, portion size matters. Large amounts of fluid right before bed can cause frequent nighttime urination, which interrupts sleep and can reduce the body's ability to enter deeper restorative stages. A modest serving is usually sufficient. Third, people taking blood pressure medication should always consider possible interactions. For example, nitrate-rich foods such as beetroot may enhance the effects of certain medications that influence nitric oxide pathways. This is usually not dangerous, but discussing dietary changes with a physician is always appropriate when medications are involved. Guidelines from organizations such as the American Heart Association and the European Society of Cardiology emphasize that lifestyle adjustments work best when they support medical treatment, not replace it. Now let's step back and look at the larger picture. Nighttime blood pressure is influenced by several factors working together: the health of blood vessels, the balance of sodium and fluid, the activity of the nervous system, the quality of sleep, and the overall condition of the cardiovascular system. When these systems function well, blood pressure naturally falls during sleep. When they become disrupted, the nighttime dip may disappear. Bedtime drinks can sometimes support the systems that help the body relax and regulate pressure. But long-term blood pressure control still depends on broader habits and medical care. Understanding how these systems interact allows people to make small decisions that support the body's natural regulation instead of working against it. If you find explanations like this helpful and want more clear discussions about how the body actually works, you can subscribe to the channel. The goal here is always the same: helping people understand the mechanisms behind everyday health choices so they can protect their long-term health. High blood pressure rarely develops overnight, and it rarely improves from one change alone. But when people understand how the body regulates pressure across the entire day and night cycle, they can begin supporting the systems that keep the heart and blood vessels working well for many years.